New tonight at 6, the communities hit hardest by COVID-19 are getting vaccinated the least.
Black Americans are far more likely to be severely sickened from the disease, but as NBC4 Investigates uncovered, Black Ohioans are lagging behind in getting those life-saving shots. So NBC4 Investigates' Jamie Ostroff looked into all of this, some disturbing data, what the doctors have to say, and how much of this might be from just an unwillingness to get the shot.
A little bit, as you're about to learn. Distrust is a bit of an issue. 13% of Ohio's population, though, is Black or African American. However, that group makes up less than 5% of Ohioans who have actually been vaccinated. That's according to the Ohio Department of Health. We are still in the early phases of getting shots into arms, but doctors are already worried. Drivers line up for a shot of hope. Columbus Public Health is booking COVID vaccine appointments at the Ohio Expo Center faster than the vials are coming in. But Dr. Leon McDougall points out a glaring issue with this setup.
I think what is happening is a replication of what we saw with diagnostic testing. You would see these long lines of SUVs getting ready to get the diagnostic testing. And what if you don't have an SUV?
McDougall is also the chief diversity officer at OSU's Wexner Medical Center. He's one of many doctors alarmed by the small amount of Black Ohioans getting vaccinated for COVID-19.
It's very concerning.
Columbus Public Health Commissioner Dr. Maishika Roberts is another.
Here in Columbus and Franklin County, our Black and brown individuals have definitely been disproportionately impacted not only by COVID-19, but by hospitalizations.
ODH data shows 18.4% of people hospitalized in Ohio with COVID-19 are Black. Roberts says a lack of access isn't the only factor driving the vaccine disparity.
There is a huge distrust or mistrust with the healthcare community, with the government, and that is valid. I mean, it comes from years of treatment that has not been favorable for Black and brown individuals.
Which is why health officials are recruiting Black and brown community members to help with a massive public information effort.
I've had a lot of conversations with a variety of members from the community, from the faith community to the immigrant community, to hairdressers and barbershops.
They're also recruiting more minority doctors,
so that when you do seek care, you can have a provider that looks like you and that understands some of the issues that you're dealing with as a Black and brown person in America.
We have about 107 Black faculty at the Ohio State University College of Medicine.
Out of how many total?
So it's about 4.2% of the total.
An improvement from years past, according to McDougall, but during a pandemic that's shined a bright light on a long-standing problem, there's more work to be done.
This is an all hands on deck moment that we are in with COVID-19.
I asked Ohio's chief medical officer what the state can do to help with this problem. Dr. Bruce Vanderhoff told me the health department is working on getting vaccine information out in multiple languages and physically bringing the vaccine into underserved communities. Local for you, Jamie Ostroff, NBC4.